can be very daunting. And sometimes the options are really, really, really limited because, you really don't know where to turn, and you have to find somebody at home or someone close to you who has a little bit of healthcare background, or sometimes they actually don't. And you have to fall on them to help take care of your ailing relative, or even sometimes it can even be a child who has a special needs condition. But worry not, today I'm hosting the team from Integrity Care Services Limited. I've been looking forward to this for quite some time, and finally they're here with us in the studio. So we'll cut to the chase and we'll start the conversation. Hello, good morning, sir. Yes, I hope you're doing well.
Sure, I'm good, and you?
I'm doing very, very, very well. Just introduce yourself to the audience, please.
All right. I'm Godfred Fosuhene, you say. A registered nurse.
Okay.
And then head of operations for Integrity Care Services.
And
then, just like you did the introduction, we are here today to enlighten our audience about the need to seek for home care or care services when there is some medical challenges. Basically,
that's what you do. Well, if you're just tuning in and you've thought of finding dedicated home care service for a relative, for a friend, this is the show for you. This is the show for you. You've got to tune in and, get some information. But Godfred, if I may call you that, and if I may ask, why do you think it's taking so long for home care services to become part of, our caregiving system?
All right. This is Africa, okay. we happens to be last in everything.
Unfortunately.
Yeah. Our way of thinking and how we accept or adapt to new things is the problem, I must say. Because in the outside world, these things are happening, and it's really helping. It's really helping. But here in Africa, there's this, I think we will get there. There's this thing going on, and I always get pissed when I hear people talk about them. Our leaders, or let me say our people, have allowed these things to go on for years. Now on radio, on TV, you hear people doing these things, and I'm like, where are we heading to?
But, people would argue that, in years past, if you had a sick relative at home, the family would take care of the person. The family system would take care of the person. And that's taking your ailing father or mother or grandfather to a care home was equal to neglecting them. Is that what it is?
So, Doc, that's the challenge we have now. So your mom will be, your sick mom or your dad, and then they are like, oh, Auntie Mansan baby cry, you school or TV, me uncle find I'm like, how? And this thing has been there for years.
Yeah, it's been going on for a long time.
And even as at now, it's still happening. So why? Auntie Mansan Bano, they know him.
So TV on your way.
Does it guarantee the person, or is it, a certificate to take care of a sick person? We are talking about life here. And you are thinking of Obi or Tifi Inti. Omramesha Mami, Omramesha Papa. Is it that you don't value the life of your parents anymore?
Well, maybe it's because people usually think that there isn't much that older person needs. Maybe it's just give them a pill or make sure they are comfortable, or does it go beyond that?
It goes beyond that. So imagine your sick dad, and then Auntie Mansaba. We are Auntie Mansaba with here and Patronye, no. Very sorry, we are just using that,
I like that.
ideology to draw point. So antiman sabano say obano or share mommy and dadia. What does he know? When he checked the BPs and the BPs are high, what does he know? Does he even understand the readings on the machine? When your sick parents that you've given it to Antiman Samba to take care of, when the situations are low, does she understand them? What to do? So it's a big problem. It's a challenge.
Okay.
You see, the old adults needs intensive care.
Okay.
It's not about just taking their medications. I witnessed a case. This woman was taking nifedipine. She's hypertensive and she's taking Nificat. And then nana no one in China or Shannon do only man say anopebiano or man on Nificat no 30 milligram.
Okay.
She has been serving the Nificat for years. Now the woman BP has dropped below 100. And she's still serving the Nificat because she say anopebia everywhere drone mano. And that's what she knows and she's following that.
Yes, so
before we realize now woman are drone to ash.
So the idea of home care is not just about it's not just about give medication.
No. Even that concept of give medication, if you had to go into that alone, doc, I don't think we will even finish the program and then we'll be done with that conversation.
No, I want to finish today's program.
People think, oh, I got to do no pharmacy na Mako hospital ye do na mam need that's it, and doctor say no na no pay we anwumre, and that's even a different this thing. No na no pay we anwumre. So about 11 a anopa, right? About 1 a year. And about na job 12 and see anwumre nyesa. So look at the ideology how people take medications. Oh, doctor say I don't know minimum na no pay we anwumre. Into a between a bone was about 11 okay, so 11 no say anopa, and then she take the medication. Hey, made a make baby, so I was about 1 on a moment no medro ni bina doctor say a boy we are minumbi. So one no medro no it be 11. About 1 or numbi. Because yes, one no na anopa we anwumre. The concept of even taking medication, people don't understand it.
So it means that having home care service or having someone take care of people who need personalized care at home is not an easy task.
Trust me. People think it's just about serving medications. Oh, one No, it goes beyond that. That's why when it comes to integrity care services, we deal with professional nurses. You don't want to risk your relative's life because I don't know how Africans we value life. Imagine your dad who has lived, Papa Bionma wa born a bra. There was this man that we are now taking care of, and maybe they've done all that they need to do in life, making sure some of your mama BCCE. Now, so a jumenti, they don't have time, and they are elsewhere. Obia baby, and near Jai Sam Papa Fu, we must have your ma bra. Say, Empo Papa on born a bra crana. This is the man or the Obasa see so.
Yeah.
Nafi a drum cra. You saw I say, oh Papa, I'm paying for sure. My see if you are not so sure, Mamma must see to. I do the time I am sure Mamma must see to now. Then we neglect them. Obisi, my father, dear, no cry on Shadan Yario. No one will feel.
But isn't it about people really not? I don't know how to say, but people really not having the time or probably the money when it comes to home care. Is it that home care services, for anybody who is listening, when you think about it, you definitely have to think about cost. Is it expensive? But we'll come to that in a bit. So what kind of patients or what kind of clients are fit for home care services?
All right. With integrity care services, once there is a disease, integrity care services show up.
Okay.
Not necessarily even the sick ones. Like I was trying to give a narration. Some people are like, oh, my papa ne dear, my mama dear, ne ho yɛ den, but no one no feel. Leaving your dad or your mom alone in the house is another sickness.
Okay.
They will be bored. They will be there alone. They have nobody to confine in. They have nobody to have that bonding with, and then they feel neglected. Before you realize that, that's when the dementia and all other things come in.
Things will set in.
Yes. So when you go to the outside world, we have people. They are not sick as in how we define sickness, but because of their mental health, they don't want to be bored. And then you see nurses taking care of them in their house. They're having that free time. I mean, conversation all the time, trying to take away some pressures of them. They are not necessarily sick. They are not hypertensive. They are not diabetic. But if you leave them alone in their house, in some few times to come, dementia sets in, and it's another disease. They don't want it to even come in the first place. So to prevent that, you see nurses around working on them. But like I said, this is Africa. This is Ghana. Adapting to the home care, it's a big challenge, but I know we'll get there.
All right. If you're just tuning in, this is 107.9 Orange FM, and this morning we're having a conversation about dedicated, let me say that way, dedicated, tailor-made healthcare services, either in the comfort of your home or, under the care of a home care service that is able to provide medical care for people who need it, and that is Integrity Care Services Limited. They are here in Kumasi, right here in Kumasi. So if you're listening here in Kumasi, or if you're out of the country and you're listening, trust me, there are options for you when it comes to where you can get the needed healthcare and the needed monitoring for either an adult who is unwell or even a child, who has a specialized condition that requires monitoring, or that requires somebody who knows how to deal with such emergencies. And today we're giving you all that information right here on the Orange Health Lounge. We're here on your radio every Saturday from 8 a.m. to 10 a.m. and my guest is Godfred Fosuhene. He's the manager of operations at Integrity Care Services here in Kumasi at Koduah, so just around Silom Hospital. Godfred, so what type of patients are suitable for a home care service?
I love this question. We take care of everybody in the first place. We take care of everybody, every sick person. And then mostly when you hear of care home, it's about the aged. We call them senior citizens. Yes, the senior citizens. They are our primary focus. And then people with disabilities. Okay, yes, some people who have other forms of disabilities. And then people recovering from illness and surgeries. You see, I remember I have a brother who lives outside Australia, and then she was having some she was being sent to the hospital for surgery. So I was calling to check on him time to time. So I called the last time and she was like, I see you may free hospital, they may call care home. I was like, care home? What are you doing there? And I was like, oh, I had the you are you knew my uncle fee straight to. You need to get to the care home. A surgery, so I was say care home on care home on shemia till 2 weeks time now. Doctor say me bra for review no. Na me sako. Now, ye chrome has say when somebody is sick and the person is being discharged. Charlie, you are you doctor say 2 weeks na me dem ho abeche. Doctor say 1 week na me dem ho abeche. That's not what the doctor is saying. There's something called continuity of care. Get to the right people. Let them take care of you for that 2 weeks period and then come back. But yeah, continuity of care no nipa no found. So even in cases you are acquiring any surgery, before so 2 weeks in so on break no. Now would not get complications infections are setting.
So it's more about, it's not just elderly people.
It's not just elderly people.
Post surgery
cases, yes.
Post surgery cases,
yes.
Who are in their recovery period.
Sure.
Instead of thinking that home is the next place to go, can consider going for a home care service for just that short period, isn't it?
Good.
Okay, all right. So we're going to go through the kinds of patients or the types of patients who should, patronize a care home. And like I said in the beginning, do our really possible best to let you understand that even taking an elderly infirmed patient to a care home is not equal to neglect. We've been joined by Miss Josephine Koduah. She's also a nurse, isn't it? Or a physician's assistant at Integrity Care Services Limited. Welcome, Josephine.
Thank you.
Yes, she's fashionably late, but we'll take it like
that.
We'll take it like that. But let me bring you up to speed. So I was telling Godfred earlier that people are very conservative when it comes to subscribing to home care services. You're a physician's assistant. You work with home care services. Is it that people find it uncomfortable when they bring their relatives to home care services? Is it equal to neglect?
No, it's not equal to neglect. I think they don't understand what we do there. That is why they don't bring their relatives there.
To make
and
me
even
understand.
If they do, there are other people at home saying, "Oh, you bet me a share, you bet me a share." So why would you send the person to that place or this place? So when you come there, it's not just neglecting the patient.
Okay.
Or like, wapuni panel. There's nobody at home. There is somebody at home, but you are short of competence care.
Okay.
Professional care.
Yeah.
Yes.
So the home care service is, a step down from a hospital.
Yes, a step down from
a step down from a hospital, and you are sure that the people who are there are trained, certified, and qualified to take care of the person.
Yes.
All right, isn't that interesting? Let me announce our WhatsApp line. If you want to send a question or a voice note in to ask my guests anything, you can send it on 05939329993, 05939329993, and yes, we'll play for you and we'll answer your question for you. Good morning to you, Kingsley. Kingsley is watching and he's saying that he's enjoying the show. Now, and I mean, I'm going to ask both of you. So, how does one come into a care home? Like, do I just wake up one day and say, I'm tired of this old lady. She's always in the house. We can't go anywhere. There's nobody to take care of her. So let's go and keep her in a care home. Like, she's well, she's just old. Do you admit such patients, or do they have to have a pre-existing medical condition before we can admit them to a care home? So that's what I want to know, because you can have a quote-unquote normal elderly person, no issues, but just that there's nobody at home to watch them, more or less. Are those the patients that you take care of?
All right. I think this one will be a conversation. So you help us.
And I also think that health is not just let's say the ones that you are sick that you need a hospital care. Sometimes they just need companionship, somebody to talk to, somebody to be with, and their relatives are not around, as she said earlier. So not only those who are sick.
Okay.
So look, even personally, if you are bored and then you have nobody to confine, you have nobody to share your thoughts with, and you keep yourself in the room for like 2-3 days, you stand before the mirror and you see that there have been changes. You are draining down. You have no medical complications. There's no medical issue, but because you've been bored and you decide to keep whatever is eating you up to yourself, and you are not sharing, you are not talking to anybody, you are always in your room, even though you are eating and all that, but because you don't have people around you, because you don't share, because you are quiet and there's boredom, all these things, you start going slim. You stand before the mirror, like I said, and you will not be seeing yourself. So it's not about the aged. It's not just about people who are sick. If you think you leave your old mom or dad in the house alone, grandpa, grandma are there with the kids alone. The kids has no medical background, so they can't take care of them. I remember there was this man, he was like, oh, I got crying, will be any few by me money pounds square no more or more question. I'm like, money pounds come question is a saying. Because Omano Omopon school, then so I'm gonna be a Brewana, then no money. I'm gonna be a Cocrana, then no money. So it's not just about people with medical complications or medical issues, but because there's nobody in the house to take care of any mamanti, you can bring them to the care home. There's a lot of games, there's a lot of fun over there. The place is fun to be. I remember man be ne papa by was like, hey, a hotel and say a cave. Yeah, no send a bay, wow, crowd ya dance here beko. Oh, papa no, I bring one the neighbor no. Seeing the place alone should be a therapy for Nipana the neighbor. Yeah, so obetim de obiaba on shed then here so be yaren kwa because uja na jejem no quantity and so yare.
You can even consider it a vacation. The best place.
Yes.
Yes.
There appears that there, so anything.
So it's a very engaging environment for people. But I keep getting the same message over and over and over again about people who are, how do we disabuse people's minds that sending your parent, the parent is closer, your parent to a care home is not neglect. Like, how do we, because, the person has probably built their own house, they're on pension, probably in their 70s or 80s, and yes, there's nobody to take care of them, but they are home, like they're in their own building. Yes, I get the Godfred's point that the house is lonely, that there's nobody there, but at least they're in their own property. How do we get people from this is not healthy for them because anything can happen in your absence to let's take them to a place where professionals are to take care of them? Is it cultural? Is it that people think it's unnecessary? How? Because yes, it's sometimes people keep sending me and saying that, hey, home care power for my father or mother, I won't do it. There's a lot of resistance, isn't there? So I mean, you have started the business. The people who come around, what brings them to integrity?
All right. So you mentioned, is it cultural? Yes. This is Africa. We are not enlightened on that aspect that much. who are you to tell me to take my dad to a care home? Who are the people going to take care of him or her?
Mm-hmm.
Get it? So we seems not to accept, say, this is the new way to go. Now your dad, you can have a big house, a mansion, whatever, but do you have the expertise around? Do you have the needed things to keep your dad healthy around? You might think, oh, you know, you're a man come. Oh, my dear, no one said that or you're ready in the hospital. But it's not enough. That alone is not enough. When you go to the outside world, we have escapades, some billionaires, and when they get to that stage and they realize that we need care home, they leave their mansions, they leave their properties, and seek proper help. And when here, and then again, send a bear and nipping who say, baby, or then papa ne corner, or then mamma ne corner, and your baby are kekeno. That's why integrity care, when you come to our senior care home at Josephine, the place is a whole fair. So even if what a mansion be clear, maybe a swimming mother crana, would you do honor at least yet the a bit competitive, yeah, ebia and two fee no. But you see, say, oh, okay, I had your baby phone. I remember one woman, he was like, my Adam cry, my man, me buy and many are due because we'll be a medan and say. Some people come and they are like, is it a hotel or like, so we are a woman say, oh, fee or no, oh, fee come on near daddy, but baby, I will ban a be a honya bad. The ideology of, oh, me family papa care home near daddy, no, maybe Nipano who back whom you be. I'm not here to destroy somebody's business or say something about somebody's business, but I've been to some care homes in the cost of having our own senior care home. Yeah, that call other care homes be. And because on family mammy and papa uncle care home, you maybe are owning a because the kind of name a cost rooms in your be senior. Trust me, AB and dog on our crime to rooms in.
But let me ask, how are the I think I have Hefa on the show soon. Are care homes also accredited by HEFRA? Are they licensed? Or
Sure.
can anybody just get up and say, you know what,
No.
I have an abandoned house, let me turn it into a care home?
Oh, no.
So care homes have
Yes, they are regulated.
HEFRA licensing,
Yes.
isn't it?
Integrity care services, we've done that.
Okay.
Yeah.
And even aside the care home, we also have a home care where we visit you in your house.
Okay,
take
so
care
you
of
do home visits.
Yes,
We have the
home visits.
home care
Home
and the
visits.
care home.
And then the care home.
And a care home.
Yes.
Okay, we'll come to home visits in a bit. But Josephine, so when somebody comes to the care home, are we continuing their medications that they are already on, or do you have a system where you can review and add on and take out and all that?
Yes, we do have a system where we have to like review your plan, your medications, and then even add on.
Okay.
Yes, so sometimes we do continue on what they bring, and then other times, depending on how their health is, we have to take some of them out and add our own.
Okay. Perpetua wants me to find out from you, can somebody stay with their relative in the care home?
Yes.
Oh, really?
Yes, they can, but they can't stay for a prolonged, maybe an hour to come and visit, and then you can go back home.
Okay, no, I'm sure she's asking if, let's say, the person is admitted to the care home for, let's say, 1 month, 2 months, then they stay with them there. Can they stay?
That one, no.
You can
Okay.
come for
But you
visits.
can come for visits as many as you want.
As many times as you
Many
want.
times as you want,
Okay.
but you can't stay.
You can't stay there with
Can't
them.
stay there.
Okay. All right. So Petra, that's the answer for you. You can go there anytime you want, but you can't stay there and live with them.
Yes.
There at the care home. Someone also wants to find out, saying that good morning. It's interesting to know that care homes are available now in Ghana. He's saying that besides the activities that they undergo in the care home in Ghana, what is the minimum number of days or weeks that people can stay? I'm asking because out here, and I'm sure he's outside the country, saying that out here, people can stay in care homes for years. So, at Integrity Care Home Services, what's the period, and who decides how long a person stays there? Do you decide?
Okay, so
If you decide, yeah,
so with the duration, I'll start from a second, from a second to the number of years the family wants.
So it's an agreed choice between
between the health professional and then the family,
and the family,
and the patients themselves.
Okay.
Because sometimes the patients are, I still want to stay even though I'm fine, but I still want to stay.
I still want to stay
because of what they've seen and then what they've experienced. So they still want to be there.
I remember we had these stroke patients. God being so good, the physiotherapist and then the speech therapist worked so hard on her, and then she was fully recovered. When we were taking this lady back home, senior not done it a year or so, and then the family too were like, "Oh yes, sure, Brefi." So at the point I've been in this because and you say say bia nipa ni sugu we dey osu am on who say osu say on person be coffee. You get it. Yeah, so integrity care service ne be deciding. Yeah, ne family no nyina agree on. Yeah, and then she'd be like, "Oh, okay, maybe 3 months, 6 months, 1 year." We have family, they are like, "Yeah, person on wasa."
Okay.
Like, okay.
So even for people who, let's say, have a stroke, you have physiotherapy services there. Yes. So it's not just about the person is there.
No.
You have.
That's what makes integrity special. I mean, we are unique because we do all the all the experts are there. Exactly everything that you need at the hospital. Integrity Care Services will provide for you at the comfort of your home and or more. Yes, and more. Because we have dietitians. So when you are admitted at a care home, a senior care home, the dietitian will come, assess you, get to know. They plan with the medical team. Madam Josephine is part of the medical team. So the medical team will plan. The dietitian is there. You're like, okay, she needs to take in this, not to take this. She's supposed to take this in the morning, not to take this. Yes. And then the medical team, they do their own thing. So it's not like you are there and then no. If you need physio services, the physio team also sit down and then they're like, okay, these are the kind of services this person will need. If your speech is not well and then you need the speech therapist have to come in, they also do their part. So it's a group of the nurses are there, the medical team, the dietitians. It's not just about the physio. It's not just about you being there and then nurses taking care of you. No.
It's interesting.
The hospital setting kind of care is what you get at Integrity Care Service.
It's interesting that people are reacting to our conversation this morning. You can also send your comments and your reactions in on 059 3932 0593932 We're talking to Miss Josephine Koduah and Mr. Godfred Fosuhene. They are both with one of the finest care homes here in Kumasi and in the Ashanti region. That's Integrity Care Services Limited, and they are located right here in Kumasi. They're not too far away. They're just at Koduah, around Sinum Hospital, and then they have a care home which is at Jeso Selwa Krat, and as we're hearing, they offer quite a lot of services there, including things like physiotherapy, diet management, pharmaceuticals, lab services, and then wound healing. I think it makes quite a lot of sense to consider if you have the need for these services, to think about somewhere like Integrity Care Services. 05939329993. That's the WhatsApp line. You can send your text or you can send a voice note, and we will definitely answer it for you. Josephine, somebody wants me to find out from you that is it only, okay, the question is a bit unclear, but okay, is it only cases like stroke, which we know is very common, that people like to admit to care homes, but what about people with, okay, you mean psychiatric conditions? Okay, all right. Yes.
They can bring their relatives, their patients, whoever they want to bring, with dementia, with whatever psychological problems they have, and then we can take care of them.
You can take care of them.
Yes,
there.
we can.
Okay, so then, I mean, for the person who sent it in, sometimes it's very, very difficult to have patients with quite disturbing diagnosis, or even somebody who's just forgetful. Person has Alzheimer's or has early dementia or has Parkinson's. You want, maybe you're traveling for a few days, you're traveling for a week. You want to take them somewhere that someone who is professional, like Godfred said in the beginning. It's not just someone who knows that I'm supposed to give them medication 3 times a day and just picks any pill and gives to the person 3 times a day. You need a dedicated team of highly qualified medical staff to be able to provide this kind of care for you. And that is what Integrity Care does. So you said you have the care home and then you have home care.
Home care.
So which one is that one too?
So the home care has to deal with you being at the comfort of your home, and then we come into you to take care of you.
Oh, fine.
Yes. Fine. When you want, and then how you want it.
Okay.
So it's convenience at your doorstep.
So if I'm not feeling well, you come and take care of me.
Yes, we will come.
Oh, so now the hospital is coming to the patient. Oh, yes. Nice. And is that only for elderly people or for regular normal folk?
Regular normal folk, anybody, everybody.
Okay.
No matter the age, no matter the gender, just call us.
Okay, so let me read a text that came in earlier. That someone was Kabina Darkon was asking that how do you balance profit in terms of keeping somebody for a very long time because they are paying, as against the person has gotten better and can leave your services. Is it expensive? Let me just ask. Is it expensive to have somebody in a home care or in a care home?
All right. The word expensive depends on.
Okay, is it affordable? Okay, you let me say this way. Is it affordable? Mr. Fosuhene has a career in politics. He has a career in politics.
All right. So
is it? You let me ask it. Is it affordable?
It's affordable.
It's affordable.
Sure.
Because if I ask, is it expensive? The answer he will give me, it will be, So it's affordable.
I'm saying this because there was this man who needed our service for her sick mom, and then after everything, what we do is that we have assessment team which I'm part. And then, so once you call us, we don't just be on phone and discuss monetary issues. Because as a matter of fact, we've not seen your sick mom or dad or whoever you are requiring the service for. So assessment team needs to come, assess the case, and then we do reports based on that recommendation and everything. So after everything, we send the invoice, and the man was like, "Hey, we there for Papa, and your mama is me." You get it. This same invoice you send to somebody, and the person will be like, "Hey, Pacho, I heard the This is
some of better songs."
Old Tom, there once you cry, obviously somebody will come and be like, "Oh, take 50 pesos." Yes. So the word expensive, like I said, it depends who is saying.
So it's affordable.
One thing we should know is that when you are sick, just
Try not to put a price tag on it.
Yes.
Just try. Even though we know the economy is
The economy is a bit, shaky, but it's affordable.
It's affordable.
It's very affordable.
It's very affordable.
Depending on the kind of service that we render, the kind of service that we give. Trust me, it's affordable. And I don't want to go a certain tangent, but those people who have been going to the other way, hence, and the other call for no more yard, but to be brave now, or money, or money, mamma for yari.
Even consultation fee.
Boom. Last Thursday, there's this man be having this same conversation. Prostate cancer, prostate. And Oshazi said, "Oh, developing pains when you see, it was like, hey, no, you didn't say no pemu yari," and then she take it or call it. Yeah, I know for your home, 60,000 gone. As we speak, man down. No name so cramp say a prostitute later. I know their hospital knows they say a prostitute.
Well, when it comes to healthcare and healthcare options, unfortunately, the alternate practitioners of healthcare are less tightly regulated as compared to the other side. So it's a tricky area, but patients always, like I always tell patients, before you take a decision about the option of care you want, you have to satisfy yourself that this option of care is actually going to solve my problem and not probably going to make it worse or make it no different. And it's even cuts across, even to what we call orthodox medicine, that if the option that is being given to you may not do much for you, after a lot of good research, you are at liberty to say no, like this is not something I'm going to go for. But that said, something like wound dressing or wound care service, people usually come every day or every other day. Do people have to come to Integrity to get that done, or do they have to be admitted just to dress their wound?
Well, I would say depending. But in most cases, we visit them in their homes. Trust me, I was supposed to be here exactly by 8, but I was a bit late. I get in 8:15 or something. I've done 2 dressings before coming here. So we visit them in the comforts of their home.
Okay.
And then the dressing is nicely done aesthetically. You make sure you get what you are requesting for.
Okay.
Yeah.
All right.
So with the wound dressing, you don't necessarily have to come there. But like I said, it depends.
Yes,
right?
it depends.
Yeah.
Sometimes the wounds are septic.
Okay.
You would obviously need maybe IV medication, so you might need to be admitted.
Okay. So it's a matter of having the wound assessed,
Yes.
so that the team knows whether this is something that probably will be dressed a bit more aggressively, more regularly, than maybe something that is not septic, a clean wound that will be dressed on alternate days or something like that. If you're just tuning in, this is 107.9 Orange FM, and you're listening to the Orange Health Lounge. As always, my name is Dr. Kwesi Jima, and I'm here this morning with Mr. Godfred Fosuhene and Josephine Koduah. They work with Kumasi's, foremost care home service, that's Integrity Care Services, and this is a really, really, really good option for you if you're even in Ghana or you're outside the country and you've been looking for a place, especially for your sick and aging relatives. For all of us, for those of us in healthcare, we know how difficult it is when, an older person usually falls very ill and there is absolutely no support system at home to take care of the person for a prolonged period. In the early phases, it's always really a bit easy to have people rally around the person, But trust me, after about 2 or 3 months, everybody wants to get back to their usual lifestyle schedule. And that is where the challenges set in. But I can confidently tell you that Integrity Care Services here in Kumasi is an option for you to consider. And today they are here with us, answering all your questions, answering all your queries about how their services work. And we've taken our time to ask them, especially about cost, because that is what everybody thinks about when they think about care home services. And there are quite a lot of, I mean, this business model is blowing up. There are quite a lot in Ghana at the moment. There are quite a lot in Accra, there are quite a lot in Kumasi, and they're all over the place. But like our team in here just said, take your time and probably visit the place, look at what they have, look at the state of the rooms, and we'll come to that with my team here in a bit, like for them to give a visual description of what the rooms look like, so that people can picture it in their minds and decide where they want to go. Are you putting our sick people in dormitories? Are they in a dormitory? Are they in single rooms? Like, what is the room situation like? Tell me about it.
All right. So, I'm to give a visual display of how our rooms looks like. All right. So we have VIP. The VIP, just like the name implies, VIP. So you need just only one person. You have your TV, you have your fridge, you have your air conditioning. That's when, if you feel like using it, a toilet and bath in there, and then your microwave. So basically everything, you have everything in your room. That's the VIP session. You have your wardrobe, everything that you will need.
Okay.
And then you have the 2-in-1.
You have two people in one.
Yes,
Yeah,
the shared rooms.
People in one room. That one too, you have your wardrobes. You have not just small wardrobes.
Big wardrobes.
Yes, like the ones we use in our homes. Very nice one. And then you have your TV, you have your fridge, you have everything as like the VIP bar. With this, you are 2 in a room. And then we have the 3 in a room and then 4 in a room. The 3 in a room, 4 in a room. People will be like, then they'll be interfering each other. No. We have curtains parting between.
Okay,
them.
so there are 4 in a room, but they are partitioned from each other.
Yes.
Okay. Okay.
You have your TV. You have everything that I
To yourself
mentioned
within that space.
Yes.
Okay.
By in the room you are 4, and then you are 3. Yes.
Okay. So you have a VIP single, and then you have the double.
Yes.
Then you have the 3 in a room, and you have the 4. Just that in the multiple occupancy rooms, they have partitions that separate, each bed from each other.
And it's nicely done. I don't know how I would describe this.
I should pay a visit to Integrity Care Services.
You should.
And
would love
those
it.
of us listening, when you go to the site, you see exactly what we are talking about.
So this is your site at Sewekra.
Yes, please.
Okay, so that is where the home is.
Yes.
Okay. But are you online? Do you have a Facebook?
Yeah. Integrity Care Services. Our website. When you go there, everything is there.
Oh, okay.
So those of us listening, Integrity Care Services.
On Facebook or just on normal?
Integrity, INTEGRTY. Yes, Integrity Care Services.
Okay.
I'll be happy if you go to our website.
Yes,
instead of
So
it.
that you can check.
Yes,
Okay.
So I'm doing that for our listeners. So for our listeners, you can just go to integritycaregh.net. Okay, integritycaregh.net, and it's there. It's a beautiful blue and cyan color, and it's lovely. Well, the rooms are lovely. The beds are hospital beds and home beds. Ooh, and the bathrooms look nice. Wow.
So one man was like, is it exactly what I'm seeing, or when I come, it's a different
It's a
ballgame
different
together?
thing.
Daddy, exactly what you are seeing. Yeah.
Someone is asking me to find out from you that how do you manage accidents that happen in the care home? How quickly do you inform relatives when something happens to their loved one in your care space?
All right. So if you have your relatives with us, it's not just us. It's about integrity and you, the person who brought the patient in there.
Okay.
Nothing goes there or nothing happens without you being informed. So, in as much as you are not there, everything that goes on over there, you are aware. So there's not like a big gap between the family of the relative and integrity care service. No.
Okay.
We don't do that. It makes the work difficult if you create that gap. But if you collaborate with them, every single day what happens, they are aware. Some people, those of us listening to us in the diaspora, they are like, I want to know what's happening every day. We sometimes create a platform for them to enter our system, so they even get to know what's happening right on their phone.
Okay, so like if you want to know the care status or the health status of your loved one,
yes,
you know every day.
Yes.
Okay.
You just pick
But
your
we
phone.
try as much as we can to avoid accidents.
Okay.
We do.
Okay. Because I think it's something that people worry about. Yes, that what if Abira or Koshe form and as baby says here, Ombeka chemi and answer Ombeka tasso.
And that is why we also offer the hospital grade beds. Because sometimes they are restless. So we say we're free to have a shift from. So when we see the patient and then how their status is, we give them that bed to avoid that accident.
Okay, so from your initial assessment, you can tell whether this person will need
this kind of bed,
or that kind of bed.
Even the nurses, we can't leave the person for even 2 hours or more. So kakrebe or baba beshe, oh here baby, oh are you okay? Do you need water? Sometimes they will try to like get the water themselves because they were all right before. I feel on my area, so yes, or baba beshe, or baba will you whatever you need to avoid these accidents. But it's here we will let you know.
Okay.
Even with the washrooms, mostly in Penny for their 4, maybe or call washroom no partially, and then I don't know if you can see from the site, the washrooms, tiles near the afternoon, you're making sure that in your tiles are sleepy too much.
Okay, so these are more rustic anti-slip tiles. Okay, all right.
Very good. And then we don't even allow them to go in there alone. They are always assisted by a nurse. Yes, and we don't create that vacuum, say BBSC, and then we will not tell the family because no, we don't do that.
And somebody will also think that when the relative is there, as a way you need, no, we will let you know what you are doing for the patient. As you already said, we send you their care plan, what they do. Sometimes we even let them exercise a bit and say, during the day, or to me nante call a diner home, or to me nante call bedroom. We give a bed bath. Whatever you do for the patient. In the journey, in the morning they ate this. In the afternoon they ate that. Maybe what to me poo because sometimes when they are even at the house, yes, so we do everything.
You update you on what's happening. Yes, I think it's a question that someone asked that is it the relatives that provide the food, like the meals? If I bring my mother there, am I the one who is going to go to market and go and buy all the meat and fish? And so it's all part of the bill.
It's all part of the bill. So their laundry, the water bill, the light bill, their feeding, everything
is all inclusive.
All inclusive.
Oh, people, this is fine, though, isn't it?
Because it's a vacation on its own. Bring them. It's a vacation.
This is a well-deserved vacation, especially for
most times. You're more crab. You're more hassy.
Okay.
And then they need this. I'm not saying say be going to me, but Yeah, we crying by Toshi.
It's just to come around.
And then
Then add it to their bill to their relatives.
But sometimes you don't.
No, sometimes you don't even bill them. Yes. Because a boama upon dinner saka.
Yeah.
Okra will feel now, oh yeah, we are saying I'm cutting more honor and I'm release stress. Yes, okra now how much more for they need this. But we'll move here now, will be any other job yes I'm on. So it means your mobile the last time you call Rattree Park. The normal bisa when you see Papa be a crab was 19
Yeah. I think I like the idea of you even being able to take them out of the care home and give them and like an environmental stimulus. Okay, so let me announce the phone lines now. If you want to call us and ask a question of my guests, you can call us on 0541 022 0541 022 that's our call line. Just call. Ask maybe there's something you wanted to ask that I haven't asked for you. You can call in and ask the team directly. 0541 022 That's the number to call us on this morning on the Orange Health Lounge. And this morning we're talking to the team from Integrity Care Services. They are here in Kumasi. They offer dedicated, tailor-made home care service. They can come to your home and take care of you, or they also have a care home at Ejusosewekra. You can go there, like they said, for a week, for a month, for a year, even if you want, especially when you know that you're that busy, you don't have the time to take care of your ill relative. They will do all that for you, and more importantly, they will also give you an update on how the person is doing whilst they are there. And like someone asked earlier, they do their very best to make sure that the environment that the patients are in or that their clients are in are absolutely safe, and that accidents and falls are at a minimum. I will pay them a visit. I don't know, maybe this week, because the worker is on my way to work. I'll pay them a visit this week and go and see for myself what happens there. This is the Orange Health Lounge. My name is Dr. Jima. 0541 022318 0541 022318. That is the number to call us on. You know, we've always been talking about like adults. What about do your nurses or do your staff go into people's homes to go and take care of them over a prolonged period of time instead of they coming to your residential facility?
Yes, that's what we started with. Integrity Care Service has been in existence since 2018. And as at then, there was nothing like a senior care home. The one who engineered the discussion or what we are discussing now, Samson Obey, a nurse, and then he was just visiting sick patients in their home, rendering service for them, dressing their wounds, giving them the care, and then gradually she was adding up nurses. Then they were taking care of sick patients in their home gradually, and now we are here. So even visiting them in their home is the grandpa of what we are discussing today.
Okay.
Yeah, so that's what we've been doing for years. The senior care home just came in about a year or two. Yeah, so for years we've been visiting them in their homes, giving them the care and everything in the comfort of their home. We send our nurses, they come, they stay within a period. Mostly we alternate them, we change them, for reasons best known to the company. We alternate them. Somebody stays for a month, and then another person comes, and then just like that. And then our physio too, if the person needs physio, if the person needs a dietitian, everything, the hospital setting kind, and it's being delivered at the comfort of your home.
So you provide you coming into the person's home
Yes, please.
to give render care to the person in the comfort of their own home.
Yes.
So you do so for children as well.
Yes, for children.
If somebody has a child with special needs and they need a healthcare person in the home. So that one, what's the arrangement like? If let's say the staff has to stay, or how does it work?
The staff can stay overnight for, let's say, 4 hours, 2 hours, 6 hours. It all depends on the patient's needs and then the relatives, what they want, and then what we advise. Because sometimes we can't come there for maybe 2 hours, 3 hours, and then leave. We have to stay overnight and monitor the patient. So in those cases, yes, we can offer overnight stay for those patients.
Okay. So it's not just about.
Then some other patients also don't even need nurses. They have HPT, hypertension, they have diabetes. Just we visit them at their home and then review their medications, look at their BP profiles and then their glucose profiles, and then we can just give them their medications and leave. So sometimes they don't need even the nurse's visits or the nurse's care. They just need the medical team to review their medications and then leave.
All right. So that is also available, especially for those who often think about the fact that going into hospital and joining a queue can be.
Yes, some people are also yes. Some people are also conscious of their hygiene. Some hospitals are not, in quotes, very clean.
Our hospitals are very clean. They are just congested.
I'm not just saying that. I have to, and then sometimes we to me have infections from the hospital. We are nosocomial infections.
So for home, you can have somebody that you go, let's say, every month to go and take care of them.
Every 2 weeks.
Okay.
Every 2 months.
Okay. And then you also have people that maybe it's a child, the child has peculiar needs and the parents have to go to work. So they
as we speak, I have this tracheostomy case that we'll be attending to on the 21st. As we speak, the child is at Confanochi, and then our service has been they've approached us, so we'll be working on.
You're working on that angle.
I think after giving the family the assessment reports, the woman was like, "Charlie, minimum never age, much as some professionals." So that is it. And
okay.
Yes.
Okay.
In as much as the aged is priority, these are nurses. We can deal with every other case.
Yeah. I like the fact that your team is very multidisciplinary, because they are PAs, they are nurses, they are physiotherapists, dietitians, and all that. Don't you want a doctor, or you can't pay me?
We do have, and then we want more.
Oh.
There's always room for more.
My charges no, and I ask them. My charges no, I ask them no. But I mean, I like the fact that there's a team of people, speech therapists and all that, who are interested in making sure that the person is well. And I think that is the most important thing, especially when someone has been through very hectic surgery or a very hectic medical emergency, and the person is back home and there's a lot of anxiety about everything that the person has gone through. I mean, imagine someone has had a severe stroke and is recovering, and everybody at home now has to do a crash course in medicine, which is not easy. Which is not easy at all. So take that stress off yourself. Don't worry yourself with a lot of YouTube videos and TikTok videos. They may not be accurate. Call Integrity, okay? Call Integrity Care Services. And their number is a bit easy to remember. It's, don't worry, I'll say it for you. It's 050 19191. Easy number. Or 050 30 00018. Another easy number. We'll post it on our socials so that you can get in touch with them. But phone lines are open: 0541 022318, 0541 022318. That's the number to call us here on Orange Health Lounge to ask your question, to clear any doubts in your mind. So the food the food part, Charlie, you let me ask this question. All right, so the food part. So is it that they all eat the same, like to say dining, like say like secondary school dining? Today is today is rice, so we are all eating rice, or it is like obiani di obedi.
I remember saying that once the person gets in there, our dietitian works on the person. So wajuani obedi, eni me mejuani amedi, enyepe. Oyari, eni me yari, enyepe. And the dietitian will not even force it on you. Once say yeah, me wa for ne there, some perception about him. So we sit the patient down, explain to you very well. I'm saying Ayana senipan on tiasia na ye difficult, but chichi muno tiasia like, oh okay, and then they accept it. So it's not like said your kind JHS and SS you could dining to mostly
and even sometimes they can request for what to eat.
Yes.
Oh, sir.
Woman be because already for you now.
Yes.
Oh, really?
And see, when you're at the care home, it doesn't stop you from eating your bankun, your fufu, your TZ, whatever you want.
Okay.
As long as it is like according to the plan.
Okay. Yeah, so that's a good thing.
Maybe or private room and maybe or multiple rooms. Maybe a dietitian a diet for this week and then we're going to a penny ball or no. It's your own dinner. Yes, so they are yet Nigiani at the amount. Near show dear so they were Gianni Diam. And yes, mass a Gianni or no, it's not done that way.
And then also just said Gianni do at the pan.
Okay. So it's not really like because we're doing it for older people, we have done any 2x4 food. Yeah.
No.
Okay.
I think started since 2018 Senemekano. Share that public way be board but but we have a good number because show also the
okay.
And that has been our standpoint. So taking care of one topmost priority because Obekwa could be a dancer on our dear dancer never go. And young for no movie TV so now or Marco Farmer could not be chat and be almost so we take good care of our clients.
All right, and that's for me really important when it comes to what we're talking about this morning, that you should have a dedicated team of people who know exactly what to do for you. Let me pick this call. Oliver, I hope you can sort me out here. Just a minute. Okay, so for some reason the call has dropped, but Oliver is here. He fixes all. He fixes all. So let me announce the phone lines again: 0541 0541 022318, 0541 022318. That is our call line. If you have any question or question as in Bisibia Efa and then Comodia regarding home care service, this is the time for you to call. I think it's a really important conversation that we don't have, you see, because even allowing people. So how do you pick your staff? Like, what are the kind of staff you have? Are they properly experienced? Are they properly trained? Are they properly groomed? Wouldn't say someone allowing someone into their home is a big deal. So nobody wants someone to come into their home and then they'll be uncomfortable. So if, let's say, I ask a care nurse to come into my home, am I responsible for their upkeep, for feeding them? Am I supposed to house them in a room? Like, how does that work out?
All right. Doctor Busa questions bear for. Yes.
Betaitis are.
Tiabasa ma. I'll start here and my picking me answer, and then you drew baby no the backward be shame or said.
And then my fault, fetch me.
Doc said the questions more I bear in pa. All right. So say your nurses no. How we pick our nurses? I'll start from there. And yes, oye nurse wako school na wako jinim the entity for 3 years, 2 years, 4 years until where you can work with ITS. No. Yeah, shall see any day na sana near no. But we realize that if you want to give quality service, we need to up our game.
Okay.
So what we do is that after picking you, we train our nurses again.
You even need reference before we can pick you. We need somebody to endorse you.
Okay.
Because sometimes we will have go school fine. They grade year when you're a license, but still their work ethics years.
Okay.
Because we are working with human beings. So we interaction with the other person. They will say you're okay.
Okay.
And then you're okay, and somebody will
endorse it. Okay.
Yes. So we have a training center. We hope to see you this week, and then we will take you around. So when you come there, we have a training center, a very spacious room with tables and chairs, everything, big screen, and then we train you like 3 days training. Intensive. Even though you are a nurse, but we still train you 3 days intensive training. And then after that we are like, okay, now we can take this person out, because obi feel obi su ne ban bia obekwa akodan na di wo ho no. I think one of the reasons why I'm man for be brave so no mom pe sa nurse bi betena ni fie ni ade den sa de no onim nipa na oba no ochina nkon na bia akofa obi bi na odiko men kai nyina ya recently I think somewhere last 2 years lady bia guy bi eku na ko fa ne niam adwane no si ope help us then it became
yes it was a big news.
It was a big news. Okoya on the woman nkwa na ofi on you like say woman am say on share na man for share near and oku na ko ofa ne cars ne niam adwane. You get it. So people are a bit scared, but trust me, you are dealing with a company. You are dealing with Integrity Care Services.
Even the name says it all. Yes. Integrity, isn't it?
You get it. So you are at the right place. We give you the quality service. Our nurses are far from all the negative things that you think of. And if anything even happens, you hold us responsible because we sign memorandum of understanding. Yeah, we sign contracts. Okay, so it's not just like, oh, me nurse. No. No. You have a nurse who is well trained. Aside the wakun in entity na wakunyani certificate no. Yes, I training no on top of it. So about a juman a top notch.
Okay.
And I'm quite assessment or bequai. Woman no what's na US or say no ye care ni be. Na the assessment ni be biano. It was like, you guys are not imitating what is happening over there. You are doing exactly what we are doing over there.
You're doing there. Okay. So it means that the standards that you aspire to, or the standards that you are working with, are the same standards that people should be experiencing out there, isn't it?
Yeah.
This is really good, isn't it? This is really, really
And
good.
I think you also asked something about the housing of
Yes,
nurses.
the housing of the nurse.
Yes.
It depends.
Okay.
Say, some nurses don't come and stay overnight.
Okay.
Some of them will stay for an hour, 6 hours, 4 hours.
Okay, and
Those
then go.
They won't actually need accommodation. They just need somewhere to sit, or share patients, no, or call. So on that. But for the accommodation purposes, no, and we for nurses now stay overnight.
Yeah,
They need
in.
somewhere to stay. So that's one idea. One of the provide the accommodation among.
Okay.
But
And
if I say, oh, share or punching here and or Doris idea or something like that.
sir,
Yes.
are you?
Yeah. So what I'm trying to say is that oh, share nurse in any year, even though they are not there for eating competition, and yet if you are it's yes.
Okay.
But it's nice to be nice sometimes, at least. Yeah. So yeah, say nurse wo na ye Johnny. She's taking care of granny. Maybe ya ye Johnny na ya madness. Even though maybe a bit more Koduah, but just look at it.
So when it comes to the person living in, you provide that service as well, and then there has to be a humane arrangement. Let me put it that way. A very humane arrangement between the hosting family and then the staff who is staying in. And I'm asking this. I'm saying this because it's really important that you also take care of the person who is taking care of your loved one in your absence or under the circumstance that you find yourself.
But we have, in most cases, nurse so obviously it's the nurse who will be cooking.
Who will be cooking? Yeah, okay.
And only
okay.
Problem because definitely do over no man.
So you train them in those aspects as well. They must be paying your nurses very well then.
We do.
We do pay our nurses well.
Okay. So if you're a nurse and you're listening, you're completing rotation in the next 1 month. I think you're finishing in May. Integrity Care, if you open their portal, they are recruiting. So they're recruiting. So you can consider it as something to do whilst you wait for your permanent posting. And I think it's something that we need to also encourage people to get into locally. I don't see why you'd pay 40,000 and 80,000, 100,000 to travel to the UK or the US and go and do the same thing. And probably harsher weather conditions and the harsher conditions when you can probably get it here. So 0541 022318, 0541 022318. We have just about 17 minutes to run out of the studios here at Orange 107.9 FM. This is the Health Lounge. My name is Dr. Jima. 0541 022318. Someone wants to know do you have a social media policy for your staff who are doing the living and then those who are also in the home care facilities? And they're asking essentially because lots and lots of people are hooked on social media and it can take their attention away, or they may even video the patient in the process. So someone wants to know, do you have a social media policy?
So this is why the training is important. Patient confidentiality is very key. We have policies like that for our nurses, and even after the training, you personally, you dare not try something like that. When we were in school, we were told not to do things like this. So you've been taught already, and then ICS has given you the chance to know the do's and don'ts. So why then do you go and do same? The only time you see our nurses on phone is when the person is entering a data, because we've moved from writing notes to typing. I mean the digital system now. So everything they do,
they key it in.
Yeah.
Okay.
So when you see them on phone, it's not necessary that the person is Facebooking or TikToking or something. Yes, they are basically trying to chat whatever they've done.
Okay.
Yes, but aside that, if you see one, I think I'm not supposed to say this here, but fine, let me do this. One thing our nurses don't know is that once we send you to the home, let's assume Josephine is coming to take care of you. We will give the person who requested for the service an assessment sheet at the blind side of the nurse.
They'll have to assess you.
Yes.
Okay, so that's a good thing, isn't it?
More like a KPI.
And my name, and it's already on their way. What they take it.
Just take.
The punctuality.
Just assess.
So at the end of the month, when we come for changes or we come for visits, the nurse is not even aware. They are listening and they are upon us about one thing. So you think say we are not there, so we are not watching. But nipa no emu no yamo no so assess so. Ba onya aware. So omo ya aware there on say hi nipa no we say no so. But yama onya aware.
But I think it's a good thing that you have structures in place to monitor, to check people, and also to give the person who is paying for the service, a way to assess people. And I'm happy that people are interacting. And to those who are thinking about it, and all those who are sending me the messages privately, yes, I think that for me as a doctor with several years of practice, usually I don't like saying it. Then people start guessing my age, but but I mean, I've been practicing medicine for 15 years, and wow. I sometimes wish that certain patients would not go home, would go to a place where we know that somebody else is taking care of their health like how we would want it. Great. Because sometimes you give people, some medications are injectable, all right? Some medications are injectable. Sometimes you need to monitor them with, finger pricks. And there's nobody in the house who's ready to do it.
The diabetics. Oh my God.
There's nobody in the house who's ready to go and prick the abrewa for the abrewa to say, I don't know, they are there, woman. And they may not even do it properly.
Yes.
So sometimes I know a lot of people listening, we all wish patients could go to a place where they would get that level of care and monitoring so that they don't come back to the hospital with something as simple as something that someone at home could have solved. So, yeah, I'm very biased to care homes, really, really biased to care homes. Someone wanted to find out if you do catheter changes on home care basis or if they can come to your facility for catheter changes.
Oh, we do catheter changes.
Okay.
As a home care.
As a home care service.
Yes, as a home care service.
Very good. So if you are
the comfort of your home.
Yes, if you are somebody you are listening, we'll put out their numbers again. Once you know your catheter size, your catheter type, they'll come to your home with all the equipment and come and change it for you.
And even serving of medications. We can even come to your house to serve your medication, give you your insulin shots, everything, whatever you need.
Oh, this one is easy. It's I don't say it's a butcher bagana, but it's not. It is healthcare development, which is late in coming, but it has come. It has come, and I'm sure probably in the next decade, this is going to be literally everywhere. To those who have children who have special needs, I want you to consider this. It is not shirking of your parental responsibility, trust me, because I have met countless parents who have kids with special needs, and one of them has had to sacrifice their job, or their life, or their academic progress because they have a child with special needs that they need to take care of. I think the guys from Integrity Care Services can do that job for you, and they can monitor, they can feed. They are properly trained medical staff who know exactly what they're doing, especially with those who have wounds.
Sure.
Especially those who have wounds. Sure. So that one, do I have to buy? I was saying, Tony man and I'm the dressy crew na na say mo amon dem de be ba.
It depends.
Mood be can bill ne ho.
Yes.
Okay. Then you bring everything.
You
because
bring
you can't say
everything.
if you don't want to
And taught the also auto.
Yes.
Okay. So
so
you bring everything.
Yeah.
Just please. I know there are people who are listening this morning who have someone who has a wound in the house, and because of that, you have literally ostracized the person to one part of the house because the wound smells.
Yes.
And nobody wants to go there. Nobody wants to touch it. Please call Integrity Care. Let them come and dress it. Listen, sometimes the most offensive wound just needs proper care, proper dressing. Yes, and the
proper
person
diet.
proper diet, and the person can now obey pay.
Oh,
You understand? Because like Godfred said in the beginning, the SS graduates in the house or GSS graduates in the house who you are forcing to become a healthcare person, he or she is not going to do it, wholeheartedly.
Yeah.
It's like a punishment. It's like a punishment for the person. But please, let's take these care options that are available by Integrity Care as part of. Listen, you may not have someone now, but save their number. Just keep it on your phone. Somebody may need their service. Somebody may require it. Are you only in Kumasi?
No.
Oh, sir.
Not only. Maybe I'm here. Wherever you need us to be, just call.
Oh, you see.
Come and assess.
They're everywhere.
Yeah, everywhere. I think last week I went to Accra,
Mm-hmm.
and then hopefully this coming week I'll be going to Accra because there's this woman I share no Agric.
Okay.
Na I say my sisters mo best rano already. I must subscribe to a BL Accra already, but by now be 2 weeks. I'm share the way you see ye human. You enjoy woniness in Kwasa. Ye ba rounds.
You go round to check on the patients.
So a young woman, a young moffe, and now they are saying, say, we should bring them nest.
Okay. You bring them a nest in Accra.
Check it. And then they are subscribing to us. It's a
good thing.
You see difference.
It's a really
and then your numbers is I am an eye for Senebeya Obia Bitimi Apike 0501 919191. In about 0501 Nivea, Diakaya 919191 when you're 10 digits. And then 050 30,018 050 30,018 and 050 That's it.
Okay, so that is something for you to, to consider. Something for you to consider.
And aside that, we also offer palliative care.
Sir.
Yes, we offer palliative.
Which one is that one?
Say you have a relative, maybe at NAC hospital when you cancer be metastasis is seen at cancer not so the doctor is saying, oh, to me, yes, to move finding coffee. Be a wheel of coffee and cool.
Cancer.
Yes, cancer. The patient is also a human being.
Exactly.
So we offer services. You bear alleviating the pain. You give comfort. You bedding como. You offer service.
So they also offer palliation services for those who have cancer, especially in the terminal stages, so that they offer the comfort and sympathy as well as the empathy that they need to have a very comfortable life. And you may be wondering, how do I find money to do all this? Now, let me tell you something about ABSA. If you don't have an ABSA account, well, I do, and you're wondering how that rich auntie, that chairman, that work colleague, the people I'm talking about, why they are getting more than you are. It's only because they have an ABSA account and they are enjoying priority treatment with preferential rates and amazing rewards and seamless digital banking solutions. With Access Banking, Insurance and Investment Solutions, the next big story to write is yours. Sign up for an ABSA account today if you don't. And it's the weekend. There are a lot of games playing on the EPL, on the Spanish Liga, on the French Ligue 1. And we've all been there where you've placed the perfect multi-bet. It's all going your way. Everything is ticking green until it's not, and one or more picks lets you down. Well, Betway has a special feature called the Bet Saver feature, and you can win even if your bet loses. Even on multiple losses, you can get your bet back. Bet Saver is exclusive to Betway, and Betway says get way more. Betway is regulated by the Gaming Commission of Ghana, and we say bet responsibly. Do not borrow any money from anywhere to stake any bet. And my guests this morning have been the team from Integrity Care Services Limited, provider of dedicated and tailor-made home care and healthcare services for the sick and the elderly. They offer compassionate home care services, professional services with a comprehensive team that can give you an environment that promotes very good healing and then support. Today you've heard it here on the Health Lounge. They offer eye care, mental health, ENT services. They have resident doctors and nurses. They do home visits. They have living services. They offer wound dressing and diet management as well. They're located here in Kumasi at Kwadaso behind Silom Hospital. That's near the Kwadaso SDA Nursing Training College. And then in Kumasi, that's in Ejiso, that's where their care home is, in Ejiso Sewekra. You can call them on 051 91 91 91 051 91 91 91 or 0503 000018 0503 000018. That's the number to call them on. Anyway, guys, any final thoughts before we run away from the studio?
Well, I think Akaba could be a yanka.
Sure.
And I'm going to know how we be any so. Canada be a more piloting program for caregiver services.
Okay.
And then I'm out for any abre. Say, we have recommendation letter. And I say, opposite yen train you. Like I said, we already have a training center. So if you are interested in traveling, we are not traveling agencies, no. That's not what we are saying here. Get the information right. We are not traveling agencies. But if you need reference letters, if you need certificates as a proof that you've undertaken any healthcare training, Integrity Care Services, we render such. And then so we're going to now your dream of maybe traveling outside Canada or UK, wherever, to do your care program. No, yes, you beat me about because I'm on for see they are going to name the new year or system yeah. So if you two coin now here reference letter and certificate be a training be a Integrity Care Service that we will sort you out. Now yes, yeah, after the days we beat me about more to coin no. We didn't come on and can be far nurses home visit no. I'm saying say uti na ebia o de on hye ka obenya busumi bia Dr. Murphy mehwe yeah the medical team no everyone more say oh nka menya nka 2 weeks bia Dr. Murphy mehwe me kono no here nurses and na on here say bia de ne beba oni mo pese every 2 weeks bia and every 1 month bia Dr. Mehwe no we do that one because on who say okodiki hospital be delay near any time here no our team will come, doctors will come and review you review your medications and everything. Yanka I for them say if not be honest with them the I team not sending me message say ya but na ya can ada any say yanka on I for I would say Mr. Mama ya I team number Mr. Oh any who how be so and also so and before a doctor for almost share any. Okay,
so that one is also at your like your Kwadaso branch, isn't it?
Yes.
Okay.
Yes.
All right.
The ENT.
All right.
Almost send the message say ma can't ada we
All right. So, Josephine, you have the last word.
Well, I said
Uh-huh.
we are an organization of certified professionals. We also have a residence and in-care home at Ejoso. So if you need services, we are saying show relative so the number. You don't have to worry. Just bring them. You better show my mom.
All right. So, sure.
Me last me see another. Yes, I telemedicine.
Telemedicine.
Yes, please.
Okay.
Say ABA. And yama a course of radios and TVs in a dozen. Wrong information everywhere. Me pacho ABA what be before wapum de on the other day. Here Dr. Binan in a bobo, here Dr. Binan Neddy Uncomo. At the comfort of your home, even at your office, care will crown out here. You just offer integrity care services. We will link you to our medical team based on question now or busano. Na in DNA and Shishamubia or Peno. Doctor and Obedin Como on phone. Telemedicine. You don't need to ABA come to us. You don't need to go ABA. Just on phone. Adebia in Chiremubia or here bia efa oya rebi home apomude hu sembi bia wati na wadwen on tantan. You just a call away and then integrity care services will sort you out.
Okay.
Sure. Something little.
Josephine never forgets to add with a little fee. And that brings us to the end of this morning's exciting session. For all those who have been sending me messages, really do appreciate. And I'm glad you like the fact that such a service exists here in Ghana. Like I said, this week, probably on Monday, I'll pay them a visit, see how the place is, and give you a shout and write it out on my Facebook wall. This has been the Orange House Lounge. My name is Dr. Jima. My guests have been Miss Josephine, Koduah, and Mr. Godfred Fosuhene. And they are from Integrity Care Services here in Kumasi. I'm back again next week, Saturday, on your radio with another exciting edition of the Health Lounge. Stay tuned here on Orange and keep listening. Have a nice Saturday. Bye.